Here I have a pleasure to introduce a patient of mine that I treated since last year. She was a 47-year-old female with extensive stage 4 breast cancer that was initially diagnosed in 2014 February. At that time she was seeing her oncologist, and because she had extensive disease she was not willing to try any palliative treatments. At that time any curative option was out of the table for her. Her oncologist recommended to start her on injections of Xgeva for her extensive bone mets, which she received in 2015 for 7 injections. Gradually her tumor progressed during 2014 and 15. She was unable to walk because of extensive disease that she had in her skeletal bones, and the tumor gradually invades into the dural space and leptomeningeal disease is confirmed. She presented to me in June of last year, 2016, when she was unable to walk and she was unable to perform her ADLs, the daily functions, and she was desperately in pain, and her oncologist referred her to me, as she had seen and saw great results that we have accomplished in very advanced cases like her. When I saw her, I went through the treatment program with her, and I explained to her that although we're not against any conventional treatments, but at this time, as her oncologist had concurred, there is not left as far as what conventional treatments could potentially save her. We started her on IV epigenetic therapies that we have designed in this clinic, aiming at both improving her quality of life and hopefully getting an antineoplastic effect. In a matter of just 2 weeks after I started her on the treatment, she was able to gain function. Many of her labs that were drawn before starting the treatment confirming that she had metastatic disease with very high levels of tumor markers, circulatory DNA, and circulatory tumor cells, they all dropped. CA15-3, CA27-29, circulatory DNA, which was positive for fibroblast growth factor 2, and PI3K phosphoinositol 3 kinase, they all became non-detectable in a matter of just 2 weeks of treatment. Her ability to function and gain quality of life was so impressive that she did not have to use wheelchair anymore. She was able to walk. We continued the treatment in several weeks after that. We were able to show amazing response in her PET scan. All highly metabolically active lesions that she had in almost every bone in her body, including femurs, humerus, skeletal bones in the vertebrae, sternum, and skull, they all had shrunk and reduced significantly, almost to complete resolution. She at that point was also referred to a good colleague of mine, Dr. Christopher Duma at Hoag Hospital, to be reviewed and possibly considered for whole brain radiation because of her dural and leptomeningeal disease. She refused that option, and she opted for Gamma knife on several of these skull lesions. In combination with our treatments, we were able to accomplish significant response in a matter of just 2 months after her MRI that was done in October. She was restaged with second MRI in January of 2017, and further in March of 2017. The post-therapy MRI confirmed partial response to the treatment with 50% reduction in the volume of the dural space disease. By the way, she had paralysis of her face. She was not able to move her half of her face. Her eye in the left side was always open. She couldn't close it. And it was completely resolved. So she had no residual neurological deficit. She did not receive any whole brain radiation, neither she received any intrathecal chemotherapy, which is the standard of care for her case. As you know, the literature confirms that there is no single patient that has ever been reported with this stage of disease that has ever recovered. Also, what is interesting is that there is not a single case that I have seen that shows any sort of improved survival beyond 2 to 6 months in this situation. Well, as we speak right now, she's been my patient for over a year. Her scan continues to be almost with no activity. She has absolutely perfect normal function and quality of life. She just traveled to Paris with her family and was able to help her granddaughter as she was born. And she has no toxicity from any of the treatments that she's continuing to receive in her treatment, in her clinic. We are very pleased to have her talk after this introduction and let people have the story heard from her firsthand. Thank you.
Hey there, it's me again. I'm just going to give you an update. As you might recall, the last time I was on video, I talked about how I just had huge improvements from Dr. Nezami's treatments. Well, after that time, back in August of 2016, I had a PET scan, and the most amazing thing happened. All of the cancer that had been in my spine and arms and legs and hips and everywhere but my hands and feet, it was resolved, which is, I think, the fancy word for saying it's inactive, it's dead, it's not there. And I've been able to enjoy the status of having cancer resolved now for several months. So I've continued here with Dr. Nezami's treatments. My blood labs have improved, and I'm just thrilled. So now I'm on a maintenance plan. I just come in once a week, and I'm just absolutely thrilled. And this has enabled me to have amazing quality of life. And not just that, but to enjoy a new grandbaby who was just born. And I'm just so excited and thrilled that Dr. Nezami is here and that he's able to help so many of us. Just today in the waiting room, all of us are just rejoicing over all the good news that so many patients are hearing. So if you're thinking and considering, come see Dr. Nezami. Thank you.